Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
Jean Marie is not with us today. Collectively, we're the hosts of PodcastDX. On today's show, we are speaking about dental health for those living with Ehlers-Danlos Syndrome.
There are several dental health problems that may occur due to genetics, one of them being Ehlers-Danlos. This disorder can threaten our dental health in several ways. First, periodontal disease. It is the most major oral manifestation of this syndrome, which can lead to early loss of teeth. Patients diagnosed with periodontal disease and EDS usually have attachment loss, mobility of the teeth, and resorption of the roots, which enhance the probability of tooth loss. And the gingival tissues?
Yeah, gingival.
Gingival. Okay. They're very fragile, and bleeding can be difficult to control during any dental surgeries. There's also hypoplasia of the enamel, which is often noted. This is a condition where the enamel does not form properly, and it's weak in nature. The teeth can also be present with deep grooves.
Grooves.
Grooves?
I'm sorry, I didn't spell that right.
Okay, I thought that was a dental term.
Yeah.
The teeth can also be present with deep grooves, pulp stones, and the roots shortened. And in the EDS patient, tooth movement has been noted, which may accelerate the gum recession. Orthodontics or dental therapy is rapid due to accelerated tooth movement in EDS patients, and it is usually accomplished in 1 year or less. Unfortunately, rapid but mild relapses in tooth movement are noted usually by 18 months. Several tooth abnormalities have been noted among EDS patients. The rear teeth?
Yeah, the back ones.
Back teeth. The back teeth or rear teeth are reported to have high projections or cusps and deep fissures, and the roots may be abnormally shaped, joined, and or elongated, or the teeth may be poorly formed or even absent. The lining of our mouths, known as the mucosa, is very fragile and can tear easily, especially when touched by instruments, having orthodontic treatment, eating hard foods, and even brushing aggressively. If stitches are ever needed after dental surgery, they usually don't hold up because the mucosa is so delicate. Structural collagen and its function is altered in all types of EDS. The lining inside the mouth is often thin and fragile. Easy wounding occurs with oral appliances. Poor wound healing and excessive bleeding is common with injury as well as dental procedures. Early onset gum disease is seen in a variety of EDS patients, especially the periodontal type. Consequences of altered collagen could affect oxygen and nutrient delivery, as well as likely affecting diffusion of nutrients in small molecules, which may have a role in the observed resistance to local anesthetics. The lack of frenula, which is the central connective tissue flaps between the gums and the lips, have been noted in some studies. And then temporomandibular joint dysfunction, otherwise known as TMJ, may be present due to the fact that the collagen did not form properly, causing movement of the discs and looseness of the ligaments within the jaw joint. And this can cause clicking, popping, and a lot of pain.
Correct, Ron. And as you can probably tell by the amount of time that Jean and I have been at the dentist, we are really interested in this topic.
Yeah, for sure you are.
And then there's the GERD influence.
GERD influence?
Yeah. Gastrointestinal problems are common in Ehlers-Danlos syndrome because of the fragile nature of the connective tissue. Therefore, individuals can experience gastroesophageal reflux disease, GERD, which I have, and Jean has, GERD or irritable bowel syndrome, constipation, diarrhea, hiatal hernia, and other complications.
I thought we were talking about dental problems.
Well, yeah, that's true, but your stomach produces natural acids that help your body digest foods. Sometimes these acids travel up your throat and into your mouth, especially after a large meal. Ordinarily, our saliva rebalances that acid and the levels in our mouth are just fine. However, for those of us with GERD, or gastroesophageal reflux, the gastric acids can reach the mouth throughout the day, and this process is especially damaging when you're asleep, since you're swallowing less often and your mouth is producing less saliva. Another concern is dry mouth caused by the many acid reflux medicines. So saliva not only helps neutralize the acids caused by acid reflux, but it also helps wash away food particles and reduce bacteria that attack tooth enamel. This is why lower saliva production may increase your risk for cavities.
So that song, the foot bone's connected to the ankle bone, that really has some meaning here?
Yeah, everything is connected.
Wow.
So the acid reflux can wear the dental enamel on the inside surfaces of your teeth, as well as the chewing surfaces. Your dentist may notice this during an exam. Unfortunately, tooth erosion is permanent. If your enamel has started to wear away, you may feel pain or sensitivity when you eat hot or cold sweet drinks. You may notice a yellow discoloration of your teeth. You may find that your fillings have changed or fallen out. You may have greater risk of cavities over time. You may develop an abscess in extreme cases. You may experience tooth loss, also in extreme cases. Once erosion occurs, you may need fillings, crowns, or a root canal, or even tooth removal. Veneers may be an option to restore the look of your smile.
I guess knowledge is power. If you've been diagnosed with Ehlers-Danlos, you really need to stay on top of your oral health, number one.
That's true. And that includes good tips that I got from a website called verywellhealth.com. To start with, brushing at least twice a day in the fight against cavities. It's essential that you brush your teeth properly at least twice a day with toothpaste containing fluoride.
Right.
You can use a regular toothbrush or an electric toothbrush. Be sure to brush all sides of your teeth, front, back, and inside and top. Brushing your teeth removes the plaque, but it will also form again in a few hours, so you have to brush at least twice a day.
And don't forget about flossing, because that's also important. Food debris can get caught up in between your teeth when you're eating, and if this debris is not removed, it can lead to cavities. Flossing or using an interdental cleaner every day is the best way to remove food debris from in between your teeth.
True. Proper nutrition is also important. It plays an important role in good dental health. Eating nutritional snacks and limiting the amount of sugary drinks will help to prevent plaque from building on your teeth. Don't drink sugary drinks. Drink water instead. Don't make a habit of having frequent sugary snacks, including hard candy and other snacks that contain sugar.
And make sure you see your dentist every year for cleaning. Is it every year or every 6 months?
Well, at least every year,
okay.
Except COVID.
Yeah.
Then it's
right.
every 2 years.
So see your dentist for cleaning.
Yes.
Many cavities can only be detected by a dentist or on a dental x-ray. And visiting your dentist for regular checkups and cleanings is a key factor in preventing cavities and staying on top of the good oral hygiene. You may also want to discuss with your dentist whether you should use supplemental fluoride to strengthen your teeth. The dental hygienist can give you tips for brushing and flossing so you will know that you are doing it correctly.
That's true. And you might be able to have sealants placed. Dental sealants are a protective coating that is applied to the biting surfaces of the back teeth. The sealant protects the tooth from getting a cavity by shielding it against bacteria and plaque. Sealants are more common in children because of the new growth of permanent teeth. And sealants can benefit adults as well.
And use a mouth rinse. There are several antimicrobial mouth rinses on the market that have been clinically proven to reduce plaque, such as Listerine or Crest Pro Health.
Mm-hmm.
But rinsing with one of these mouth rinses after brushing or eating can also aid in cavity prevention.
I wonder if you could just rinse after every meal, too.
I'm sure it won't hurt.
Yeah. Now, this is going to be a different tip. Chew sugarless gum. Believe it or not, chewing certain sugarless gums can actually help to prevent cavities by increasing the flow of saliva in your mouth. In 2007, the American Dental Association awarded their seal of acceptance to Wrigley's Orbit, Eclipse, and Extra Chewing, flip the page, gums for helping to prevent cavities. Look for the seal of acceptance on other sugar-free gums, including Bazooka sugar-free bubble gum. Now you have an excuse for blowing bubbles.
I guess so. And if it's within your control, make sure you have good dental insurance.
Yeah, that's good advice. Well, I think it's time to move on to the tips, hints, and tricks lightning round of the show. 10-question lightning round. Are you ready?
Yeah, sure, I guess so.
Okay. Why is dental health important to you? Lightning. Quick answer.
Why is dental
health important to you?
Because I want to keep my teeth. Is that fast enough?
Yeah, no, it was too slow. Okay. What makes life... Good answer. 10 points. I thought you were going to say so I could shoot my archery.
So I can shoot my archery.
Okay, never mind. 10 points. What makes life easier when wearing dentures?
I would know since I don't wear dentures.
Neither do I yet.
But that's not what I'm supposed to say.
No.
Brush your gums.
Yeah.
Tongue.
Yeah.
And the roof of your mouth every morning with a soft bristled brush before you insert your dentures so it can stimulate circulation in your tissues and help remove plaque.
Good answer. 10 points.
I thought so.
What is your go-to online resource for dental hygiene information?
My go-to resource for dental hygiene information is the same one it should be for everybody, the American Dental Association.
Good answer. 10 points. Do you have tricks for dealing with stress?
Don't get stressed.
Good answer. 10 points. What do you always bring with you to the dentist office?
My teeth. And my insurance.
Okay, good answer. 10 points. What do you use as a distraction for long waits in the dental office?
I can give a plug for my dentist and saying I usually don't have a long wait.
Oh, that's a good answer.
What is 10 points?
Yeah, I'll give you 10 points. I'm giving them out willy-nilly. What is your fast and easy nutritionist snack?
Believe it or not, I actually like to snack on fruit.
Fruit, okay.
Yeah, like apples.
I'll give you apple a day keeps the dentist away, unless your tooth is loose. Good answer, 10 points. Give us 3 of your favorite recreational pursuits.
Well, now that I'm getting up there in age a little bit, they're less...
strenuous?
Yeah, but I would say archery, scuba diving, and golf.
Okay.
How's that?
Good answer, 10 points.
How about yours?
Mine, fishing, mushroom hunting, and camping.
All right.
Do I get 10 points?
I like you to get 20.
Oh, thank you so much. What animal best reflects your personality?
I think the easy answer would just be a dog.
Sure, good answer. Good boy. 10 points.
Now sit.
What do you do to treat yourself?
Wow.
Leaving them open on this one.
I'm losing 100 points here if I don't answer it.
No, come on.
What do I do to treat myself?
Treat yourself.
Watch a good movie.
All right.
How's
I'll give you another 10 points, so that's 100 points total. We have a winner.
Woo-hoo.
Well, I think that wraps up this episode.
Thank God.
If any of our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com. On Pinterest, Instagram, Facebook, Twitter, we're everywhere.
We are. And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.